We did not have someone come down and bring us needed equipment for over a year. I was specifically told that they could not come service our area because of the rising costs like gas, and I have an email that says that, gas for example, and decreasing reimbursement. We had people who couldn't go to school, couldn't go to work, couldn't ride the bus, all those types of things because of their equipment that they needed for their chairs. So it was really a bad situation. It had a huge impact on them, all of my team, the therapist. It impacted all of us greatly. So we actually had 2 patients who had significant breakdown at least 4 times. We had someone who was waiting for over a year for a cushion, and she had significant breakdown on her skin in several areas over that year, and we had people come in and do pressure mapping to prove that this cushion helps so that we could get it for her, but it took so long to get it because nobody would service our area.
One lady's chair, her brakes were broken and it wasn't safe for her to even go on the bus, and I had to fix that by putting my vice grips on her brake. And my vice grips were on her brake for over 6 months.
A wheel on a power chair completely fell off. We couldn't get anyone to come down and fix it. This gentleman goes to college. He could not afford to miss any more classes. He already missed 2 days. I was trying to contact the company. Nobody could come down and help us. So his dad finally took a huge sledgehammer and a bolt and pounded the heck out of it so he could get the wheel on so his son could go to school.
He has Duchenne muscular dystrophy, as I do, and he also has a wheelchair just like mine. And last year, I think it was, his wheel fell off, and I think he had trouble getting one for a while. We had a couple people come up and look at it, I think, and after that it just took a real long time for anybody to get on it. You know, when you need something and you just have to keep dealing with what you have. If it doesn't work well, and I guess the waiting was frustrating. You know, there's a lot of people that are affected by it and you know, need help, need equipment, and just puts a barrier up to, you know, to getting that kind of stuff. So, you know, it's better to, you know, focus on it instead of cutting it back, trying to increase it, or, you know, doing whatever they need to do to get people what they need. I guess I'd just like to ask them why it's so hard to, you know, make it easier, you know.
Did you have a hard time getting stuff for your chair before?
Yeah.
What happened?
I don't know.
You don't know?
No.
Took a long time, didn't it?
Yeah.
Yeah. If you needed anything new, like your laterals, remember they broke, they basically exploded. All the stuffing was coming out, they all fell apart. We couldn't get them for a long time, right? And before we had no one.
No.
Right?
Nowhere.
No one. We called everywhere.
Yeah.
To try to get somebody to come down.
Yeah.
And do you know why that happened?
No.
No. Why do you think?
Yeah.
He has a torsion in his spine, as well as through his hips. He has contractures in both legs. He only has limited range of motion. So the positioning of Shannon is incredibly important as far as maintaining his skin integrity, his digestion, his breathing, blood flow. All those things are all impacted by this chair. He had many pieces on his chair that were broken that we couldn't get parts for. And it's not like I can just put a different footrest on there and that's going to fit perfectly for him. He's very specific. He has very specific needs. We're supposed to be here taking care of our patients. And we can't do that without equipment. The equipment is essential to their lives, be it going to work, being comfortable, being able to eat, being able to be transferred to use the toilet. And a lot of it is for their independence, being able to let them do what they can. We try and stress here at the ARC that we try and emphasize their abilities, not their disabilities, and we can't do that without good equipment. He is taken care of by his mother. He lives at home with his mother and attends our day program here. And for her, I think it's made it a lot easier to take care of him too. So, you know, maybe that allows her to keep him home with her versus having to send him to a nursing home or another, you know, facility. See? Amen.